My name is Laurie Gregg. I'm an OBGYN by training and have been working in the physician well-being space probably my entire time, starting in training. So I've been with Sutter Health for 25 years and have the honor of being the Chief Wellness Officer for Sutter Independent Physicians for the last 6 years. We certainly know that burnout is becoming just a crisis in the physician world, as well as the nurses world and healthcare employees overall. So it's up to about 60% of physicians across the U.S. will have one symptom of burnout. The Chief Wellness Officer position is a position that's critical and certainly one way for an organization to pay enough attention to this issue. So I did help create it within Sutter Independent Physicians, and it really works well to guide the work, inspire the work, embed it at the local level, and really it demonstrates that an organization is very much committed to this. Physicians train for a long time. They put a lot of blood and sweat and tears to it, to not have a job that isn't professionally fulfilling or to have a work environment that leads to burnout. So it's critical to really support the physicians because they deserve it, but also our workforce is shrinking. And so to retain and recruit, it's really important to do this work also. Physicians taking care of themselves are important. So diet, exercise, sleep, mental health, social relationships are all important. But what's more important for organizations is to work on, is there a culture of caring within the organization, and is the work done efficiently? A mature organization working on physician well-being will focus on those latter two. How can we make the work more efficient, and how can we make the culture more of one of caring rather than stiff upper lip, don't talk about your feelings, go on to the next hard case, you'll be fine, doctor. Peer support, which I'm a huge fan of, both because I've done a number of sessions of peer support, but also stood up a number of peer support programs, I think is a great way of enhancing personal resilience, but really changing that culture. The Sierra Sacramento Valley Medical Society is worth its weight in gold, especially when it comes to the Joy in Medicine program. One thing they offer that a number of our physicians have taken up is 6 free counseling or coaching sessions, and you don't even have to be a member of the medical society to take advantage of those. You can get in 24 hours or 48 hours if there really is a crisis. So they give us that mental health platform. They also stand up peer support groups where groups of anywhere from 3 to 10 physicians get together outside of work and sometimes talk about things that happen in work and support each other, but then do things outside of work that builds that community. There is a stigma sometimes around accessing mental health within medicine, and if you have a peer support network in your hospital, some physicians might not feel comfortable accessing those peer supporters within the hospital, and some hospitals don't have the resources to stand up a peer support program. So we heard from our OBGYN members through ACOG and other social media sources that there were our colleagues were struggling out there. We created a national email address that a physician from anywhere in the U.S. can either refer themselves or a colleague for that 1-hour peer support conversation by a trained peer supporter in their same specialty. So it's been up and running now a year. There's 3 of us that staff it, and we've helped approximately 20 people so far without putting out much advertisement. So once we go higher on that advertisement, we're going to have to staff up with more. I'm certainly very appreciative to my organization, Sutter Independent Physicians. Our CEO, Dr. Dave Herbert, really saw a need and a passion in me to do this work. So he's really been enabling and allowing the organization to build the resources for a well-being structure. And then I want to thank Dr. Jose Arevalo, who nominated me for this award. He's the CME of Sutter Independent Physicians and really a great supporter in the work and the resources also. And then again, thank CMA and Gary Nye. Back in the day, Dr. Nye and I also, interestingly enough, sat at some well-being meetings together. So this is very much an honor because I know the work that he did. And so certainly my thanks go out to CMA and Dr. Nye.